The air quality in Delhi continues to remain in very poor category. Delhi's average air quality index, or the AQI, is currently 400, according to the Ministry of Earth Sciences Air Quality Monitor, SAFAR. Now, the share of stubble burning in Delhi's pollution rose to 40% on Sunday, the maximum so far this season. In the last 56 months, or nearly 2 months, there have been over 32,000 incidents of stubble burning in Punjab, which is impacting the pollution levels in northern India. For more on this, let's go across to Sukirti Dwivedi. Sukirti, the pollution levels in Delhi are quite worrisome, especially if you look at the numbers rising in COVID as well. And doctors have been warning us about the link also.
Well, yes, absolutely. Currently, Delhi's AQI is on the upper limit of the very poor category. So it's at 400, and from 401, the severe category begins. And also there has been a tweet from the IMD, the Met Department right now, saying that the air quality in Delhi is expected to get into the severe category in the upcoming days. So that's not a good sign at all for the national capital, which is already facing a spike in COVID cases. We've been registering over 5,000 cases for at least 5 consecutive days. And we've been reporting how even the biggest government hospital in the city, biggest COVID dedicated hospital, LNJP, had about only 14 beds vacant out of the 200 total ICU beds with ventilators that they have. So the severe patients have been increasing. The LNJP head had told us that as the temperature dips, as the air pollution levels increase, all of these factors will combine together to make the COVID situation worse, as this virus tends to affect one's respiratory tract, and that is in a more vulnerable state because of the air pollution. So pollution and COVID, the double whammy of that, is proving lethal at this point of time. If you look at the general data as well from the Delhi government app, there is a certain shortage, at least at big private hospitals and some of the big government hospitals. They have started seeing, the vacancy of beds is only within single digits at most of these places. So when air is in the very poor category already, this hospital bed issue has started to crop up, at least in terms of the severe patients, the ICU patients, and with air expected to go into the very severe category, things not looking good for Delhiites at this point of time.